The history of medicine is defined by milestones that have changed our way of life. For example, antibiotics provide humanity with an instrument to fight bacteria that kill millions of people. Organ transplants prolong the lives of patients who would otherwise have suffered or died even less than a generation ago. All these revolutions changed not only medicine, but the entire society. Another revolution in medicine is currently underway. Digital technology in healthcare, or eHealth, is becoming part of all areas of medical practice. Artificial intelligence devices and remote consultation wearable monitors are changing the doctor-patient and health systems interaction. The most vital question is whether these innovations will lead to less expensive and more efficient healthcare, or create new inequality risks, dilemmas, and vulnerabilities. Just as antibiotics, it is essential to use digital healthcare technologies carefully and sensibly, and that they should be accessible to all and not just privileged groups. eHealth is the application of digital resources and systems with the aim to create better healthcare delivery, prevention, and engagement with patients. This encompasses a broad spectrum of technology, including electronic health records, which provide a safe method for storing patient histories, and telemedicine, which enables doctors and patients to communicate across vast distances. Mobile app-based health reminders help people remember to take medication or exercise, while wearable sensors track blood sugar, heartbeats, and sleep patterns. AI is increasingly being used to compute X-rays, MRIs, and lab results, and to identify patterns unrecognizable to the human eye. Thanks to eHealth applications, a nurse in a rural area can instantly consult a specialist hundreds of kilometers away. eHealth can transform medicine from a more reactive approach to a proactive one, enabling the identification and addressing of risks before they escalate into emergencies, and empowering patients to take control of their health. For example, think about a smartwatch that tracks irregular heartbeats and warns its owner when there's something amiss. It is interesting to note that eHealth is not a technology problem, but a practice of building networks of communication, trust, and cooperation, linking individuals to the larger healthcare system. One of the early attempts to apply digital technology to the purpose of public health was Google Flu Trends. It was invented in 2008, and its construction was based on a simple yet bold premise that online searches conducted by people could reveal the early outbreak of disease. Google also attempted to identify influenza outbreaks in real time by analyzing keywords such as flu symptoms or cough medicine. The project initially appeared to be a groundbreaking one that would pick up trends faster than official reports. It brought great hope to governments and researchers that it would be a new tool for monitoring the spread of disease. However, there were challenges. The search patterns depend not only on actual cases of illness, but also on news coverage, seasonal advertisement, and concerns of the population. In turn, the system was prone to exaggerating cases, in some instances wildly. Its estimates in 2013 were nearly double the real number of infections. The project was canceled in 2015. Google Flu Trends showed that even as potent as they are, algorithms must be founded on clinical research and verified data. Without the connection to medical science, big data does more to mislead than enlighten. On the other hand, Estonia is one of the most successful examples of how eHealth can be nationalized. The electronic health record, EHR, was implemented in the country in 2008. It is available to every citizen. Every resident is issued a safe digital identification card, which helps doctors, pharmacists, and patients share information. Orders are electronically processed, medications are ordered and filled, lab outcomes are accessible in other facilities, and emergency doctors can examine the medical background of a patient in real time. Due to this integration, there is a minimization of duplication, the elimination of errors, saving time and money. Equally important, Estonia focused on a system that respects data protection and transparency. People have a right to know who accesses their data, which has instilled confidence in the site. The results have been impressive. The country has been able to deliver more effective care, reduce administrative costs, and involve the patient more actively in the decision-making process. The Estonian case continues to be emulated as a model for other countries to develop plausible and inclusive e-health systems. E-health innovation is not something that happens only in the Western world. Rwanda, for example, pioneered the use of drones in the delivery of life-saving medical supplies to rural citizens. In conjunction with a company named Zipline, in 2016, the country came up with a program to deliver blood, vaccines, and needed medications to areas that were inaccessible by road. Such drone deliveries have saved the lives of mothers and children in an emergency, and have significantly enhanced the survival rates of mothers and children in such circumstances. The program has since expanded to most parts of the country and served as an inspiration to other similar projects in Ghana and Nigeria. History demonstrates that digital health may be driven by applying new logistics to local needs apart from traditional infrastructure. E-health is evolving rapidly. One of them is introduction of sensors capable of monitoring movement, speech, and sleep. These systems can detect the earliest symptoms of an illness. Hence, they can be treated before they even become serious. Patterns involving stress or depression can be recognized by mental health apps, and countermeasures can be proposed. Genomic medicine holds great promise for personalized medicine, where an individual's DNA serves as the basis for their therapy. In cancer therapy, for example, genetic profiles would help in choosing the most effective drug with the least side effects for a particular patient. Ideally, the future of medicine is not about substituting human doctors, but about complementing their skills with information, knowledge, and technology that can help make care safer, more efficient, and more human. Yet there are dangers with every revolution. The top priority in e-health must be privacy. Health information is among the most personal data, and in the event of a data breach, this information may be used to perpetrate identity theft, discrimination, or even a political agenda. Equity is another acute issue. While high-income states are adopting highly advanced telemedicine and wearable technology, millions of people in low-income settings still lack access to basic internet connection and digital devices. Artificial intelligence may reinforce pre-existing inequalities when it is provided with biased datasets. Studies have revealed that algorithms have historically undervalued the needs of minority patients and hence offer restricted care. In addition, over-reliance on automated systems may reduce human oversight and control, which may lead to dramatic consequences. These challenges underscore the assumption that technology does not favor the neutral. It is a reflection of the values, priorities, and prejudices of people who develop it and put it into practice. Good ethical standards, confidence, and policies must support e-health to succeed for all, not to share the benefits with a limited and favored few. Then where does that leave us? E-health is already changing the way people obtain healthcare, and the potential of e-health to change lives cannot be overlooked. Nevertheless, its future impact is pegged on the choices that societies make today. Will digital tools decrease access differences between poor and rich areas, or will they lead to more inequality? Who should hold health information? Patients, governments, or well-established corporations? Is there a situation in which artificial intelligence can be allowed to make medical decisions without human oversight, or must doctors take full charge? And what will it take to continue to be empathetic, compassionate, and ethical in a system that is increasingly mediated by screens and algorithms? The questions are not simple, but they must be part of the future healthcare discussion. Digital health also promises to revolutionize medicine in the way vaccines and antibiotics advanced medicine in the past. Making that revolution make the world a more humane, fair, and safe place is not a random decision. It is not only the obligation of governments and professionals, but also of all individuals who will become patients at some point in their lives, which is, in fact, all of us.